My name is Marc Blatstein, the physician founder of Physician BOP Prison Consultants, a physician pre-sentence report service. My phone 240-888-7778. Today is going to be directed at the healthcare sector. The Department of Health and Human Services, Office of the Inspector General. This is it's a blog post on my website, and it's a snapshot from January. Total Medicare spending on lab tests rose in 2024, driven by, and I'm going to cover several topics. But overall, the Department of Justice from day one, quoting AG Bondi, they are targeting the medical healthcare sector. That's providers, that is DME prescribing, that is telemedicine, although they extended telemedicine through December 2026. That is, pharmacy, importing medications, importing different medical devices from other countries, generally importing, where tariffs are involved. While we're starting on chronic care management services, don't forget genetic testing. This isn't something new. We're in the age where there are biomarkers, and if you're able to get a genetic test, potentially that could fine tune your cancer treatment. Medicare Advantage. Medicare Advantage is not Medicare. Medicare Advantage is a managed type of Medicare and supposed to give you the basic services that Medicare does, but it is not managed by Medicare. It's more managed by private carriers, so that you're not getting everything that Medicare offers. Wound care, skin substitutes fraud. It's probably there's possibility for fraud anywhere, but don't forget that the Department of Justice, you are their number one target. And that's what I want to drill home. Chronic care management, patient care management. This is a link. There are other companies that do this. This is just one. If I can, it didn't come up the way I wanted to, but it's just chart span, empowering providers to focus on meaningful patient care. And it goes through what they do: chronic, advanced, annual wellness visits. They've got resources, but it's maybe worthwhile for a, oncology practice, family practice, internal medicine practice, if you have a chronic care patient, because there's now a definition of that chronic care patients, at least from Medicare and Medicaid services. HHS audits Medicare payments for chronic care management risk of noncompliance. This is as recent as 3/16, right here. Office of the Inspector General. Chronic care management is coordination of care for patients with two or more chronic conditions expected to last at least 12 months or until death, placing them at significant risk of health issues. Well, I have diabetes, I'm pre-diabetic. It's a chronic illness, but it's everything that's done to me needs to be documented by the provider. And documentation can save a practice or kill it. Starting in January 2015, the Centers for Medicare and Medicaid Services began to reimburse providers for CCM services under the Medicare fee schedule. From 19 to 2024, the services have significantly increased. Well, it's true. So has technology. They're examining now Medicare Part B payments for CCM management services that may be at risk for noncompliance. Mind you, it's crazy what's going on in the courts, where normally we've been taught that a prosecutor can indict a ham sandwich. They're not getting the indictments, but you don't want to leave yourself open. Don't pretend to be an ostrich. This is serious stuff, and documentation could save you. Genetic testing. Genetic testing is a big deal. Here's another, this came January 2026. We analyzed the metrics for genetic and non-genetic procedures. Genetic test codes were identified using a list developed by the Department of Justice, updated by OIG, includes tests for pathogens in humans. Non-genetic tests were selected from the fee schedule that did not involve genetic material. Using Part B claims, we examined trends in Medicare spending and utilization. There are 25 tests that are in this link, and we can open it up here. And this is the actual report. Coming back to this screen, if I may. Wound care is another site. This is brought on by nurses.org. Department of Justice cracks down on wound care and skin substitute cases that surged to $10 billion, written by an RN. Two owners of a Phoenix wound company conspired to have sales representatives order unnecessary skin grafts replacements for Medicare patients, resulting in one owner receiving over $275 million illegally in kickbacks. Center for Medicaid and Medicare Services indicated in 2025 that increased scrutiny of the skincare industry has the potential for fraud. So how do you get around that? You need to document everything that you're doing regarding, because you do a surgery or you can't do a skin graft, then you have to have another product to be able to cover that wound. So it is documentation. Implications to nurses and providers goes to the link on their site. Nurses may not see immediate impact from the Justice Department crackdown on wound care, but eventually it's going to trickle down. Increased oversight, greater focus on documenting medical necessities, and enhanced training. It's important. Medicare Advantage. Medicare Advantage is not Medicare. It is a HMO managed type of Medicare service where it's not managed by Medicare, but and it provides the basic coverage that Medicare provides, but it doesn't provide all of the care. And Medicare Advantage now is really the number one target from the DOJ because there's so many individuals financially who've had to go to Medicare Advantage from Medicare, and they're getting denials. And out of all those denials, Aetna had to pay 117 million to resolve a claim, but this is bigger. Kaiser Permanente had to pay 556 million, and so this is the outcomes is a result of a coordinated effort by the Justice Department Civil Division of the U.S. Attorney's Office. In gathering all of this data, the Department of Justice, Health and Human Services, they're using artificial intelligence, and I have another video on this where they have artificial intelligence and these programs, while they may be targeting different things, they have the ability to make decisions and work together. It's an awesome video that I did, but it definitely impacts a tremendous amount of more people in the healthcare sector being indicted. There's a video that I go through. I hope you have found this helpful. If you are a provider, I'm a physician, and I know what you're going through. I had a felony 2006, excuse me. There was no First Step Act. There wasn't any other programs of intent that could have helped me, but I was able to get my medical license back in 2010. Still, I know what you're going through, and if you choose to engage my services, we can begin defending you early because there are options, even with guilty by trial or plea of guilty. Again, thank you for paying attention and have a safe day. I appreciate you taking the time.